Lift is my signature program for prolapse relief, and it is something that I created for myself when I developed prolapse after my son was born. And at the time, of course, I didn't know that I was going to turn it into a program that thousands of people would go through over the years, but I did. And like I said, it's evolved, it's refined. So much has been added to it. It's been tweaked based on feedback from people, what worked and what didn't. And I mean, honestly, I'm going to keep tweaking it. And once you're in for life as far as the content of the program. And so as it changes, it will be updated and added to, etc. So that's one of the cool things about joining my Lift program. It is for prolapse relief, but it's also helpful for bladder leakage. It's helpful for postpartum conditions, like postpartum period, I should say. It's also helpful for pre and or post surgery. So if you have to have some kind of pelvic surgery, a hysterectomy, for example, or even a prolapse surgery, if you have very severe prolapse and you're wanting to really prehab in order to really make sure you know how to live a lifestyle that's pelvic floor safe and how to strengthen your total core, it's great for pre-surgery and it's also great for after surgery too. So there's lots of reasons why you might want to use Lift. How is Lift different than your free stuff on YouTube? And that's a great question that probably many people have. How is Lift different than your 750 plus free videos on YouTube, right? I know I am a content producing machine. I have a lot of free stuff out there. There's a huge difference though. So Lift is all together, all in one place. And I will tell you, I have tried piecing together free information from, various websites, from this and that, from various videos before myself, and it just doesn't work. That for me. Now, for maybe some people it does, but for me, having everything laid out all in one place is so valuable. And also, I don't offer the content in Lift. It's not on YouTube. So if you're truly looking for Lift content, it's only in my program. And it's all packaged together, so it's really easy to use. So that is the main difference. Plus, you get a lot of extra bonuses too, including the support and the community aspect. I have an amazing community and I'm in there. I've also hired another doctor of physical therapy who's in there as well, helping out. And so you get a lot of personal support if you join and participate in the community. The whole reason I got into pelvic health, the whole reason I do what I do, the whole reason I am so I'm being PG here, passionate about my work is because I have always longed to feel accepted and to feel like I can accept my own body. I didn't accept my own body for a long time. I didn't accept my womanhood. I felt a lot of disconnection from my pelvic floor, my pelvic health, my sexuality, all of these things down there. I felt a lot of disconnection. And I also felt like it was kind of, like something I should be ashamed about, or maybe it was kind of icky. You just either don't really think about it, or maybe it's something that's sort of like gross, like, oh, periods are gross or whatever. That's how I grew up. I grew up that way. And I always knew that something was wrong with that mentality. I thought, well, it shouldn't be gross, but I was brought up with that. Often the way I work is I kind of get curious about the things that I'm a little bit like weirded out by. I get a little curious about them. And so I know that this is one reason I really dove into the world of pelvic health and decided to specialize in it. But one big reason is once I started to accept myself and my own body and started to really embrace it, my whole world opened up. And when I started seeing patients and seeing them accept their own body and realize that there was help for these issues, I was gobsmacked by the fact that people didn't know. They didn't know there was help. They didn't know that they weren't broken. They didn't know that these things were normal. They didn't know that there were things they could do. And I just longed to give them a hug and wrap them in my arms and just give them love and let them know that they're normal, they're okay. That's what drives me, is to give people love and to let people know they're okay. And they're gonna be okay, and they're normal, and even if something feels off down there, they're not broken, and there's things we can do. Actually dive into a little bit about the Lift Live Round, and then I'm going to answer a few more questions about my Lift program. So the Lift Live Round is something that I offer a couple times a year, and it's a members only perk. So this is a time when I offer group coaching. So the Lift is a 5-week program, although many people take a lot longer than 5 weeks to go through it just because they choose to. You also have lifetime access to all of the content, the videos and the PDFs and all of the goodies that come along with the Lift program in your course dashboard. You have lifetime access to all of that. But the live round, essentially we go through it together as a group. So whether you joined Lift a long time ago or you are, new to Lift, you can join in, and you totally don't even have to follow along. Like if you were on week 3 of Lift and we're starting the live round at week 1, you don't have to backtrack. The whole point is it's just a way to experience some camaraderie with other people and to kind of know, like energetically, that people are doing this with you. Like you're not in it alone. You've got support. And when I spoke at a bladder health conference in early October in Maryland this year, I spoke at this conference, and one of the things that stood out to me the most was when a physician in the group, in the audience, stood up and was talking, and he said, support groups do what the medical system can't. And I'm talking about a good support group here, a positive support group, one that's not going to be dragging you down all the time. But support groups, whether that's something like the community that I offer in my Lift program or, another type of support group, they're so key because they help you realize you're not alone, and they offer you more time for connection and talking and question answering and asking than you get with your doctor or even with your physical therapist. A lot of the healthcare system providers are very strapped for time. They're very stressed. They have 5 minutes with you, maybe 15 or 20 if you're lucky. But it's hard to get that one-on-one time and to get that support. And so support groups are really helpful. And again, the Lift Live Round is a way for everyone to go through Lift together as a community. So that's why I offer it. I offer 3 coaching calls throughout the Lift Live Round. I am just essentially answering questions at the first part of Lift, about 3 weeks into the program, and then at the end of Lift at about 5 weeks. There's always fun with the Lift Live Rounds because I'm really active and involved, and I really like to encourage people along the way. In addition to the coaching calls, I like to answer questions in the community and just really make it a fun party. It's wonderful. It's a wonderful, wonderful benefit to join and to just, like I said, know that others are out there doing it with you. So can I do Lift if I'm pregnant? So the answer to that is yes. So you can do Lift exercises through your first trimester into your second trimester. Beyond that, you might want to back off a little bit. The key is Lift is wonderful for postpartum recovery, and Lift has so much content, like a ridiculous amount of content that you can watch and especially learn the lifestyle tips for keeping your pelvic floor safe. Those are essential for during pregnancy. You can learn the tips when you're pregnant so that after delivery, they're like ingrained in you. You don't even have to think about it. But what if I have pelvic pain? So if your main issue is pelvic pain and maybe painful sex or bladder pain or pelvic pain, if that's your main issue and you have a lot of tension, then I actually would not recommend starting with Lift. I would actually recommend for my programs, starting with my program that's called Overcome. And I do offer an Overcome and Lift bundle, but Overcome would be the best option to start with if pelvic pain is your primary concern. If you do have extra tension, a lot of people in my Lift program do have a lot of tension. Maybe pain is not their primary issue, but they do have some tension and they know that. I just encourage them to take longer on week 1 of Lift. And then when they're moving forward into week 2, to alternate progression. So they're doing week 1 one day, week 2 the next day, week 1 one day, week 2 the next day. And then slowly they can work their way up all the way into week 2. So in that case, Lift will take longer, but heck, you're getting more value for your money. Does it work for different types of prolapse? The answer is yes. Whether you have uterine prolapse, cystocele, bladder prolapse, urethrocoele, rectocoele, it's going to be helpful for you because the focus is on total core strengthening releasing the muscles first, identifying and gaining awareness of the pelvic floor and core muscles, and then very gently strengthening the entire core while constantly thinking about pressure management. And the pressure management is key to helping all types of prolapse. The next question is, will it prevent me from needing surgery? Well, I can't guarantee that. Sometimes surgery is necessary for more advanced degrees of prolapse. But doing a conservative program like LIFT is really, really helpful for honestly anybody. Even if you're going to need surgery, it helps you prehab, as I kind of talked about earlier, but it also is going to help fix the root causes if you have to have surgery down the road. Because here's the thing, if you don't fix it, it will follow you. If you don't fix the issue now, it will follow you. And so if you don't know how to identify and have awareness of your pelvic floor and your core muscles, if you don't know how to strengthen them, if you don't know how to use them, if you don't know how to live a pelvic floor safe lifestyle, those issues will follow you. And even after you have surgery, they'll still be there. Surgery already doesn't have a great success rate with prolapse, to be perfectly honest. And so you want to do everything you can to make that surgery a success. And so if you're not fixing your issue, your lifestyle habits and that kind of thing now, then they'll follow you. Your poor lifestyle habits will potentially make your surgery fail more quickly than if you had done a program such as LIFT or seeing a pelvic floor physical therapist or doing these things to learn about your body before going into surgery. I will say LIFT has helped many of my clients say that they were considering surgery and then they decided against it. Or their doctor said, yeah, you don't really need surgery anymore. The next question is, can LIFT help me run again? And the answer to that is everybody's different. However, if running is a true goal of yours and you want to get running again or doing heavy weightlifting again or things like that, then it's going to give you a really great foundation. So yes, many of my clients again have started running again. In fact, I just worked with somebody the other day, and she is somebody who started running again after doing LIFT. And she also said to me, and this was so awesome to hear, she said, I got more out of your program than I did of 8 months of physical therapy. So I'm not trying to knock physical therapy, go to a physical therapist in person if you can, but I was really honored that she said that to me, and she is running again. And there's also a ready to run interview that's part of the bonus content of LIFT, because I know running and more high impact activities is a goal for many people. But the key is you've got to have that foundation and you've got to build up very, very slowly and really listen to your body.